This talk for Adler Graduate School course number 504 is on the measures suggested by DSM-5, with a focus on the ones we will be using for the case studies in this course. One of the assignments for this unit is to complete the Level 1 symptom measure and the HUDAS as if you were Veronica, the case study on pages 69 to 72 in the Morrison textbook. The DSM-5 suggests a variety of assessment measures to augment the diagnostic assessment process. All of these measures can be downloaded from the psychiatry.org website. Click on the View the Online Assessment Measures to get to the page. The measures we are using in this course are also available on the course page. They are the Level 1 Symptom Measure and the HUDAS. The Level 1 symptom measure is a self-report measure designed to be used before or during the initial session of assessment. We will be focusing on the adult version, but there is a version for parents and for children and adolescents as well. The World Health Organization Disability Assessment Scale, HUDAS, assesses the activity limitations and participation restrictions experienced by a person, irrespective of their diagnosis. The Level 2 cross-cutting symptom measures are all self-report measures that provide a more in-depth assessment of a specific domain of mental and emotional functioning. They may aid you in a comprehensive mental status assessment by drawing attention to symptoms that are important across diagnoses. They are intended to help identify additional areas of inquiry that may guide treatment and prognosis. The severity measures correspond closely to the diagnostic criteria of a specific disorder. They can be self-report or clinician rated. The severity measures were developed to be administered both at the initial interview and over the course of treatment to track the severity of the person's disorder and their response to treatment. First, we will look at the measures we are going to use in this case studies for this course. First, let's look at the Level 1 cross-cutting symptom measure, adult form. Now would be a good time to download it from the course page. You should be aware that there is also a parent version and a child version available on the psychiatry.org website. This self-report measure has 23 items total, and the items are divided into 13 different domains. This measure is intended to help clinicians identify areas of inquiry that may have significant impact on the individual's treatment and prognosis. Each item is rated on a 5-point scale with scores ranging from 0 to 4. The instructions specify a time period of the 2 prior weeks. For the substance use, suicidal ideation, and psychosis domains, the guideline is to conduct further inquiry for any item that is rated 1 or greater. For the other 10 domains, the guideline is further inquiry for each item that is rated 2 or greater. The table on the second page of this measure also lists the Level 2 measures that are available and that might be used to provide more detailed information on the symptoms which have been rated 2 or higher. We will be using the Level 1 symptom measure in each of the case studies we will complete for this course. Knowing what a disorder a person has requires the application of the fine art and science of diagnosis. This knowledge helps to guide treatment, interventions, and management strategies. It can also help to predict outcome and prognosis to a certain extent. However, although diagnosis is valuable on its own, it is not sufficient for understanding the full picture and the lived experience of a patient. The adage, "There are no diseases, only patients," applies here. Keep in mind that a disorder is simply a cluster of symptoms that have occurred together during a specified length of time. Just as important as the diagnosis itself is whether a person can work and carry out the routine activities necessary to fulfill his or her roles at home, work, school, or in other social areas. This aspect differs greatly, independent of the disorder or disorders that the person has. Assessing functional abilities and understanding where the disorder or disorders is impinging on a person's life is an important part of helping that person feel understood and creating a working alliance. The domains of the HUDAS provide a useful framework for this assessment. Measuring the impact of any health condition in terms of functioning allows us to compare level of disability due to different diseases. It makes it possible to design and monitor the impact of health and health-related interventions, thus making it easier to design interventions and to monitor their impact. There are a variety of very important factors that a diagnosis alone does not predict. Some of these factors are useful in planning or prioritizing treatment, while other factors are important to have documented in the clinical record of some of our clients. Some of these factors are useful for healthcare policy decisions, reflecting the variety of functions that the clinical record may serve. People generally seek treatment because they are having difficulty doing what they used to be able to do. Exploring and defining these difficulties is a critical part of setting treatment goals that reflect the person's wishes and aspirations. It is also true that many diagnoses include impairment in social, occupational, educational, academic, behavioral, or other important areas of functioning as one of the diagnostic criteria. When an assessment of functional abilities is added to a diagnostic formulation, there is evidence that predictive ability is significantly improved for a variety of factors. One reason we want to assess functional ability is that impairments in functional abilities may last longer and be more stable over time than any single symptom or diagnosis. For example, a hallmark of some disorders, especially some anxiety disorders, is the avoidance of certain behaviors, situations, or cues. These avoidances often create limitations in adaptability and functional ability. In the absence of the undesirable cue, the person may do fine, but the avoidance efforts often create significant limitations. It is difficult to define and measure functional ability and disability because it is related to many life areas and involves interactions between the person and his or her environment. The HUDAS is based on a much larger assessment framework, the International Classification of Functioning, Disability, and Health. Domains from that larger framework were distilled down to the 6 domains of the HUDAS, which was developed to provide a standardized way to measure health and disability across cultures. These 6 domains were selected after a careful review of existing research and survey instruments and a cross-cultural applicability study. Several versions of the HUDAS are available. These include interview-administered versions, self-report versions, and proxy versions, which allow someone other than the client to provide their evaluation of the client's functional abilities. The interview-administered versions include follow-up questions about the number of days in the past month that the person has experienced the difficulty. The 12+24 version uses 12 items to screen for problematic domains of functioning, with up to 24 additional questions to define the difficulty. This assessment strategy echoes the DSM-5 process of symptom assessment, beginning with a Level 1 symptom measure and using Level 2 questionnaires when needed. For this course, we will be using the 6-item rating scale, and a copy of this scale is available on the course page. When you look at it, you will see that each of the 6 domains has several specific areas of functioning that are included in the rating of the domain. For the case study exercises, you will report your rating in each of the 6 domains, as well as a narrative about functioning in domains where you identified mild, moderate, severe, or extreme difficulty. You may want to look at the 36-item clinician version as a way of broadening your understanding of each of the domains. As you use this instrument for case studies, keep in mind that the time frame specified is the past 30 days.